Now, one of the common questions that I get from my patients is, Doctor, how do I get rid of my blocked nose? And especially at night, I'm struggling to fall asleep because my nose is blocked. Or maybe one nose is partially open, but as I go to sleep, I realize I can't sleep because it's quite difficult. Now, let's understand what is blocking our nasopharyngeal duct. And nose is the pathway through which we breathe. And when that part is blocked, it can lead to many other problems. Sleep apnea can happen. People tend to snore. This could also contribute to people snoring. And this makes the sleep not restorative. They wake up very tired. When you have a clear nasal pathway, it really helps to have a beautiful sleep and you wake up really fresh. So, one of the reasons why people say that I'm having a blocked nose is they are consuming food that has a tendency to produce a lot of mucus in their upper respiratory tract. They have a tendency that they could have allergic tendencies, having too much of sneezing, and then that leads to blocked nose. So one way is, I always tell them, there are some Ayurvedic treatments, like one of the Panchakarma treatment like Nasyam is very helpful. Doing exercise, when you go for a run or a mild brisk walking, this can also open up your nose if your nose is blocked. But at the time of when you're asleep, you can't just wake up and go for a walk. And if you go for a walk, and if it is especially, it increases your heart rate, then the ability to go to sleep will also be challenging. So sometimes people use these allopathic nasal decongestant, and when they come and tell, doctor, but this really irritates my throat and the nose nasal pathway, and morning I get up with a very not a good feeling, but I would like to come out of it and I want to have a clear nasal pathway. What to do with that? So the first thing I always tell them, get rid of excess sugar, alcohol, and too much of milk products. Like sugar, alcohol, milk products, and sometimes if they eat a lot of gluten rich, like in India we call this maida. If they have a tendency of eating a lot of maida and if you are having, some people have all of this. So somewhere they have to get into a healthier food, like minimize on milk, minimize on gluten, or eliminate gluten and milk completely post lunchtime. This is also helpful, and give up alcohol for at least a month. I would say give up for the rest of their life, but you will always see when the alcohol consumption is high, the tendency of mucus increasing in the body can also be high. I'm not saying it is for everyone, but usually in these conditions it can also happen. Another thing is, if they are constantly exposed to air conditioner, and if the air conditioner is not cleansed properly, sometimes you need to service the air condition. Sometimes it could have some fungal growth inside, and that could also lead to some infection and allergic response, and that could also lead to this nasopharyngeal blocked or partial blocking that could lead to that. So once you get rid of excess sugar, milk, gluten, and alcohol, and then improve brisk walking, like walk for at least half an hour in the morning and half an hour in the evening. This will help to improve this will reduce your mucus load in your upper respiratory tract, and on top of that you will also improve your breathing, because when you walk you breathe better. And also doing pranayama, like there are certain pranayamas like alternative nostril breathing or even bastrika, where you forcefully exhale. These are also therapies that will help to improve your nasopharyngeal opening, like unblock that part. Another thing, in Ayurveda, we have a therapy called as Nasyam. Nasyam is where we use oil or salt water, or even certain powders are used to inhale. So it will create to open up the blocked pathways. You see, when we were four-legged animals, the gravity helped to cleanse our nasopharyngeal duct. But after we became two-legged animals, anything that goes inside, it could get stuck and it could enter your system. And also just a few years ago, one of the ways to understand if there is a viral load that is too much in your body, it was through your nasal swab. They took a nasal swab and tested if your viral load is too much, because this is also an area where too much of microbial contamination or a viral contamination could happen. So cleaning it on a regular basis is as important as how we talk about washing your hand is important for your hygiene. Same way, Cleansing your nasopharyngeal duct is equally important. That is why Nasyam, it's a technique in Ayurveda to cleanse your nasopharyngeal duct on a regular basis. 2 to 3 drops of oils like Anutailam or even just saline water. Unless you have any nasopharyngeal problems where it is contraindicated, or if you're having running nose because of an infection. In these conditions, this is contraindicated. But apart from that, if in order to keep your nasopharyngeal duct open, doing Nasyam like every morning 2 to 3 drops on each nose, or just salt water cleanse. Like there are these salt water that you can pour inside your nose and it'll open up and cleanse, and you can cleanse by releasing all the excess mucus that is coming out of it. This way, it will help to improve your nasal cavity. Your breath will be much better, and you will have a much better sleep. Don't expect this turnaround within 1 or 2 days. Maybe it might take, when you practice this, giving up excess sugar, gluten, milk, and alcohol. When you reduce this for a period of, let's say, 2 to 3 weeks, that is when you'll start seeing the difference, and suddenly you can give up this nasal decongestant. Your breathing will improve, and your sleep will also improve, and you wake up very fresh in the morning. And also steam inhalation. You have a hot water, you put some eucalyptus oil, or in Ayurveda with some mint. In Ayurveda, we have this oil called Karpura Tailam, where we infuse it with camphor. And you put few drops in that hot water and do a steam inhalation. This can also open up your blocked nasal pathway. Usually, when you do a Panchakarma Nasyam, we do a steam inhalation, then we do the Anutailam oil into your nose, and that is when it is cleansed. And even after that, we do a nasal steaming. This way, it really opens up and you breathe so much better. In general, it is most of the people, they will have one of the nose partially or slightly blocked. And it's not like it is very unhealthy or something. It's natural to happen. But as you live much healthier, do more exercise, and you do pranayama and minimize on unhealthy food that is very heavy for the body to digest, that will also produce the mucus. When you reduce that, slowly you will start seeing that the blocked nose can be reversed, and you have a very easy to breathe nostril, and you will have a good sleep without having the tendency of blocked nose at night. One of the best times to do Nasyam is upon rising in the morning, because morning is one of the times when the mucus load is high. And also, before you go to sleep, you can just put 2 to 3 drops. This will open up and you'll have a good night's sleep. These are 2 times that I recommend if you have a blocked nose. And 2 to 3 drops in each nostril is ideal. One of the oil is called Anutailam, or just make a good quality salt, saline nasal wash. You could get it from the pharmacy. Just water and salt is there in it. And you could use to cleanse both the nostril. This nasal irrigation, some people call it nasal irrigation, nasal wash. By doing that on a regular basis, it will really improve your nasopharyngeal hygiene. So when people take this allopathic decongestant, sometimes they come and tell me, I'm taking this, is this something good? Sometimes people get addicted to that, and they are like, I cannot sleep without this. You have to correct your lifestyle. But sometimes if it is really, really difficult that I'm not able to sleep at all, and I'm ending up, breathing through the mouth, at that time, using this nasal decongestant is a boon for them. Whoever doctor has prescribed for them, it is okay. But try to come out of it as soon as possible. This will help to make sure that your sleep is very good, and your dependency on a decongestant. And one of the reasons this decongestant is quite strong, and it also irritates your nasopharyngeal duct. So it is not healthy to take it for a long-term period. Maybe for a few days, if it is very difficult, it's okay to take it. But over the run, try to have a healthy lifestyle so that you don't have excess mucus load on your nasopharyngeal duct, so that you can have a easy breathing and you can sleep better.